Hi guys, Craig here with the first in a series of anatomy and physiology video lectures. This is a supplementary lecture to the Prezi that you'll find on the Moodle NZIS page, and I'm going to talk you through the slides, give you the knowledge that you need from these slides to take forward. This one looks at the introduction to the anatomy terminology, the words that are going to crop up a lot as the course goes on, and it should help you navigate your way through the upcoming anatomy modules that we'll work our way through. So just have a bit of an overview of what we're going to be covering in this session here. We'll start with the anatomical position, which is a position that we presume the human body is when we talk about where things are. It simplifies things. We'll look at the cavities of the body and what's found inside the torso, in which areas. Then we'll move along into the planes of movement, how the body moves and how that relates to muscular movements and gym-based exercise. We'll talk directional terms, where you can find things in the body and where they are compared to other things, particularly organs. And we'll finish off with some joint movement terms, which will be really useful going forward into our muscle studies and obviously our gym-based technique stuff. So starting with the anatomical position. The anatomical position is a presumed position that our body is in when we talk about the location of different items. So whether that be muscles, organs, or anything else inside a body, we presume that the body that we're talking about is in the position that you see on screen there. So that is feet together, facing forward on the left side there, with hands facing forward as well. And of course you've got the back view there as well. You see the back of the hands in the back view. So just to simplify where body parts are so there is no confusion with arms being crossed or legs being crossed and that kind of thing. So really it represents a body lying on a table, a cadaver in a morgue, let's say, and therefore we should all have our bits in the same place if we're in the same positioning. So there are three key cavities to the torso. We have to have some understanding of what's found within those cavities. The first is the thoracic cavity. And you can see the picture there. That's basically from the neck at the top that you see up here down to the diaphragm here at the base of the rib cage. And found within this hollow cavity of the body here are the key organs. I'm sure you're familiar with a lot of them. You've got the lungs, we have the heart in there. We also have some of the upper digestive organs in there. So the upper tract of the digestive system, the large intestine and the small intestine there. And you've also got some really important organs in this area too, the liver and the spleen and pancreas being the main ones in there. And we'll talk more about their locations in later sessions. You move down sort of below the nipple line or to the base of the rib cage and then go down to the tips of the pelvis. So we're really talking about this segment from about here down to the tips of pelvis here. You have the abdominal cavity, obviously called abdominal because the abdominal muscles lie over the top of this cavity here. And you'll find in there the majority of the digestive organs, the small intestine, the distal parts or lower parts of the large intestine, some parts of the spleen, and then more importantly, I guess, the kidneys and the ureters being in the back of that section as well. So the kidneys obviously dripping the waste down through the ureters to the bladder, which we'll actually find in the next cavity, which is the pelvic cavity. So this is really the top of your pelvis, right down through to the base of the torso where it ends. You've got the bladder, the pea tube known as the urethra in there, and then all the reproductive organs as well, the testes, the ovaries, depending on what sex we're talking about. So three key cavities. We haven't talked about the location of the organs within those cavities yet, but we will make reference to them as we get into our directional terms. We'll make some comparative terms to give you an idea of where those things sit comparatively to each other. Next we move on to planes of movement, and these are technical terms, I guess. You're not going to use them a lot in your day-to-day work as a PT, but when you're doing your research and when you're looking up movements, they're often, gym-based movements are often stated as being on one of these planes to give you an idea of the muscles being used. And it's a good way to actually think about general planes of movement that occur within the gym or in different exercises you do. And by doing so, you can actually attach certain muscles to certain planes, and it makes it very simple to work out what an individual exercise is actually targeting. So the three planes of movement that we're going to focus on today, we have the frontal plane. I'm going to start with the one in the middle here. So the frontal plane effectively splits your body into anterior and posterior portions, meaning front and back portions. So imagine a plane of glass drop down through your body and separating you into front and back halves. And movement is along the plane. So in this instance here, movement is actually in a side-to-side motion. So your arms and legs going out to the sides. A star jump would be a classic example of that. And if we wanted to use other gym exercises to show you that pure frontal plane movement, we would be talking about things like a lat pull down. We would be talking about things like a shoulder press. And we'll be talking about things like maybe a lateral raise with dumbbells from hands at your side up to 90 degrees at the shoulder. They would be examples of pure frontal plane movements. So you can see from there a lot of those movements that we just talked about, if it's frontal plane at the shoulder, then all of those movements would target the medial deltoid. So the shoulder muscle that's responsible for lifting your arms up to the side. You'd obviously have other ones down in the legs, known as the hip abductors. So abduction is where we take the leg away from the midline, so that would be sweeping your leg out to the side like in a star jump where you split your legs wide apart, and then adduction where you bring them closer together. So those are frontal plane movements. We'll move over to sagittal plane movements. Now the plane of glass here, the blue plane of glass you see, is now splitting the body into left and right sides. So it's an imaginary plane of glass drop down through the head and splitting you into those left and right sides. And again, movement is along the plane. So this typically would look at forward and back type movements. Okay, and many of those forward and back type movements in a gym-based scenario are talked about as flexion and extension. So when we flex our hip, for example, like lifting your knee up in front of you, that would be hip and knee flexion. That's happening in the sagittal plane. There's no side-to-side movement occurring there. So some classic examples of gym-based movements that would be pure sagittal plane would be a lunge, so stepping straight forward and everything flexing in unison and then extending when you stand up. We would hope that a squat is primarily in the sagittal plane, with the knees bending and following the toes rather than moving in a side-to-side fashion. You could also argue things like a bicep curl would be in the sagittal plane as well. Typically there's no side-to-side movement going on, it's straight up and down. Okay, and that leaves the transverse plane on the other side here. And this one divides the body into top and bottom sections, and it's actually a rotational plane. So we're talking about rotation, particularly of the spine or the torso with this one. So you'll be talking about any sort of rotation that is occurring while you're in a vertical position. So we would talk Russian twists, cable rotations where you're rotating the torso. Movements like golf where the torso rotates would be considered a transverse type movement. Obviously discus throwing and shot put, the spinning and rotation that occurs in the explosive phase of that movement would all be considered transverse type movements. Now, it can be quite confusing separating these guys into their different parts or their different splits when it comes to the planes, but the reality is that most human movements fall into multiple planes at the same time. And walking is a classical example of that. So when you're walking, it's primarily a sagittal plane movement. You want your arms and legs swinging front to back, but we understand that the shoulders and the hips are also rotating through that movement. So there's about 5 to 12 degrees of rotation depending on your walking style there, where your shoulders will rotate in opposition to your hips. So that would be a mixed plane of movement going on there. And there are many examples of that in sport where we use rotation plus other planes of movement. But just to get our heads around it a little further, we've got this little worksheet here that we can look at. And all I want you to do is just take a few moments here to look at the pictures and see if you can determine the primary phases of movement that are occurring in each stage here. Okay, so yes, there might be a couple that are associated with certain ones here, but the primary phases of movement, let's see if we can identify the easy ones. So I suggest you pause the video at this point and just have a look at those pictures, and then when you're ready and you think you might have made some selections there, you can hit play again and we'll crack into the answers. Okay, so hopefully you've had a look at those pictures there and you've come to some decisions, and obviously some of these are a little bit trickier than others, so let's talk through them. Up the top here, we've got a bicep curl occurring, and I did use that as one of my examples before. Primarily that's going to happen in a straight forward to back type motion. It's a flexion exercise. The elbow is flexing and then extending, so that would be a sagittal plane movement. And the second one here, it really depends on where you started the movement. So this person here is rotating their hands in opposition to their feet. So they're going to rotate their body around and bring that hand that's up the top around to their other foot. So that's going to cause rotation of the spine there, which typically you would think of as a transverse movement, but they're not actually vertical at this point. Their arms are moving in what we'd call a side-to-side plane as it rotates there. So their arm-based movements there are actually frontal plane movements. Okay, there's not much difference between what's happening at the arm as it swings around as there would be in a star jump, which would be working in the same plane. So the fact that they're bent forward takes them into the frontal plane there. The third one's a little bit more clear-cut. This lady is obviously doing an extended lunge there, could be holding a stretch position there, and that's in a straight forward and back movement, which of course is sagittal plane. The old Goliath here doing some sit-ups is coming up initially in the sit-up, which you'd consider a sagittal plane movement, and then he's rotating at the top of that sit-up. And because he's achieved that near vertical position at the top of the sit-up and rotation has occurred, that's rotation in the vertical in a vertical position, and of course would incorporate transverse plane movement into that. The lady in the picture here with the red gears on, she's doing a sort of side lunge, I guess, and it's purely side to side, so that would happen in the frontal plane. Okay, as movements of the frontal plane are side to side in nature. Might have been a little bit tough to see what the lady down the bottom was actually doing. So if we take the example of her stepping onto the step from directly behind it, she's stepped onto it, and she's about to step off it, like in a step class. If she was coming from directly behind the box, that would be considered a sagittal plane movement. If she had stepped sideways onto the box, which you might have thought, then that would be a frontal plane movement. The lady in yellow has taken a step forward, sagittal plane, and now is rotating. So she's about to swing her arms and torso back the other way and sort of loosen up that lower and upper back by swinging around in a rotationary fashion. Because it's rotationary and because it's in a vertical stance, that would be considered transverse movements. And then the dressed bear, a little strange, is performing star jumps, and both the movements at the hip and the arms are purely side-to-side based movements there. So we talk about those abduction and adduction movements again, which we'll get onto in more detail soon. So those would be considered frontal plane movements. Okay, so feel free to listen back to those, but hopefully you can see the general idea of these planes of movements. And the next step is to think about, well, what kind of muscles, I guess, are working in these planes, and what are the locations of those muscles. So when you think about it, to some degree, a lot of our sagittal plane movements are going to be on the front and back of the body. We're talking about hip flexors on the front and quads. We're talking about hammies on the back and those kind of things. They're responsible for flexion and extension exercises. Whereas some of these frontal plane muscles are going to be found on the sides, like the medial deltoid on the side of your shoulder, like the glute medius, which attaches down in the lateral aspect of your pelvis to your femur. So they would be abductors and adductors. And then, of course, we've got these deeper core type muscles, the obliques, etc., that would be more responsible for rotation of the spine. So once we make those connections, it's very easy to break down a movement, whether it's a gym-based one or a sport one, and we can start to make some quick associations with the types of muscles that are being used. And then when you know what a sporting movement breaks down to, you can then help a person become stronger and more explosive in those movements by targeting the muscles. All right. So we'll move on with this one here. And the next little segment we're going to be looking at are directional terms. So a lot of these directional terms are words you've probably heard of. They're pretty common in the English language, words like posterior and anterior, to be deep or superficial. Most people have an idea of what those words mean. So we're going to look at them from the context of where things are in the human body and how we would use these terms appropriately for anatomy. So we'll start with the top ones, posterior and anterior. Posterior simply means towards the back, and anterior means towards the front. And there are two ways in which we can use these terms. We could just talk about the location of a singular object. So we could say, for example, we're interested in the pectoralis major, one of the chest muscles, and we could just simply state that it is an anterior muscle, meaning it's on the front side of the body. We could then talk about the glutes, which are obviously the buttocks muscles, and we could say that they are posterior. And that's pretty simple. So you wouldn't obviously hear too many comments like that. More often you would hear, well, where is something in relation to something else? And particularly within the torso, within the organs and those kind of things, the orientation of where things are. But also with muscles, maybe some muscles overlay others, and we would talk about where they are in comparison to the other. So if we use some examples here, we'll start with some nice easy ones. If we were to talk about the trachea, which is the windpipe in your neck, and the esophagus, which is the food tube in your neck. Now we know there are two tubes running parallel to each other in the neck. They're right in front and behind each other. But do we know which one's in the front and which one's in the back? So we would use these terms to identify which one's which. Now you start with the thing that you're interested in finding out the information about. So if I was interested in where the trachea was, then I could describe it as the trachea is anterior to the esophagus, meaning the trachea sits in front of the esophagus. That would make obviously the esophagus, if that was the subject of my intention, the esophagus would then be posterior to the trachea, meaning it sits behind. Another example, we could use muscles, and we could look at the muscles on the front of the thigh, known as the quads. And two of those quad muscles are actually one in front of the other. We have the rectus femoris, which runs right down the middle of your thigh and attaches into the top of your kneecap. And we also have the vastus intermedius, which runs right down the middle of your thigh. So which one's in front and which one's behind? Well, I can tell you that the rectus femoris is anterior to the vastus medialis, meaning you'd have to peel away the rectus femoris to see the vastus intermedialis, which is of course posterior to the rectus femoris, so it sits in behind. If we went into the organs, for example, you might be interested to know that the stomach is anterior to the spleen, meaning that the spleen sits in behind that stomach, and that the pancreas is somewhat posterior to the large intestine and liver, which means it sits slightly in and behind. Okay, so we can sort of give organs and muscles within the body some clarity around their location and where they sit using these terms here. Moving on to the next one, we have medial versus lateral. And medial is towards an imaginary midline of the body. So imagine there's a midline running right down through your nose, your chest, through your belly button there, through the middle of your body, an imaginary midline there. And if something is closer to that line, then it is medial compared to whatever else you're comparing. If we want to use a statement just saying that something is medial, we would say that the nose, the belly button, those are both medial. They should be directly along the midline of that imaginary line. Whereas your ears would be lateral. And of course, if we compared two things, you would say that your nipples are hopefully lateral to your belly button. Okay, notwithstanding that they're very much above where that belly button should be, but they are certainly further away from the midline than the belly button is. Okay, if we went back inside the torso, we might look at the location of the heart. And we'll talk about the heart being medial to the lungs, because the lungs, of course, surround them on both sides. The lungs themselves would be lateral to the heart. Okay, moving on down. Next to, pretty simple, we have superior and we have inferior. And superior simply means towards the head and inferior towards the feet. So, again, best used probably inside the torso. We do have other words that we use to describe the location of things in the arms and legs, which we'll get to soon. But superior and inferior is really about where does it sit location-wise within that body. So we could talk about things like the small intestines, which sit down in the main part of the belly, underneath the abdominals here, and they would of course be inferior to the lungs and heart, so they would sit below it in the sense of being further away from the head, if you like. Okay, we could talk about the bladder, which we would find down in the pelvic cavity here, and we could talk about how that is inferior to the small intestine, so it sits below the small intestine in that setting there. Okay, so higher or lower, essentially, in the body. Remembering that the body is in the anatomical position, probably lying down on a table in a morgue if we're dissecting at this point. Okay, the next two are probably some of the trickier ones that we're going to deal with. We have proximal and we have distal. Now, distal is probably the easiest to get your head around because it sounds like distant, and distant means further away from. And if we look at where we use this, we use these two terms here about limbs, so from shoulder to hand or from hip to foot. The further away something is from the attachment point of the limb, so the attachment point is obviously the shoulder for the arm. So the further you are away from the shoulder on this limb, the more distal the object becomes. And the further you are away from the hip on this limb here, the more distal the structure becomes. The closer you are to the hip or the shoulder, the more proximal the location of that item is. So we'll use some examples here. The first one we could say is if we were comparing the elbow and we wanted to know where it was in relation to the bicep, then we would say that the elbow is distal to the bicep because the bicep, the belly of the bicep here, sits closer to the shoulder, the proximal attachment point, than does the elbow. So the elbow would be distal to the biceps. The fingers, of course, would be distal to everything. And if we compared the fingers to the wrist, then even though the wrist is far away from the shoulder, it is still closer to the shoulder than the fingers are. So when comparing the two, we would have to say the wrist is proximal to the fingers because it is closer to the attached end of the limb, where it attaches to the torso. Similarly, if we took femur, which is the bone here under the thigh, and we wanted to compare it to the tibia, which is the bone down here in the lower leg, then the femur is, of course, proximal to the tibia. Okay, it is closer to the hip or the attached portion of the leg than the tibia is. Okay, so that's proximal and distal. Now, there is another use for this term, and that's where there are hollow tubes or vessels within the body. And we can talk about hollow tubes and vessels as being proximal if they're closer to the starting point of the tube, or they're distal if they're further away from the starting point of the tube or towards the end of the tube. Now, some key tubes found within the body. The first would be the digestive tract, or the alimentary canal, which goes all the way from mouth to anus, about over 9 meters in length, coiled up within your body. It would be useful to know what part you were having resected or having surgery on. It would be very good for a doctor to know, or a surgeon to know, obviously, before they went cutting in. Are we cutting into the proximal third of the small intestine, which is the starting third of it, or are we cutting into the distal third of the small intestine, which would be the last third of the small intestine? That would be good to know. Blood vessels as well. We could talk about blood vessels being hollow tubes. Is it the distal end of the brachial artery, which would be right up here towards the attachment end here, or where the brachial artery runs right through the arm, or is it the distal end of the brachial artery? And there are also a few joints that we use the terms proximal and distal for as well. So one of the joints in the lower arm here is where the radius and ulna touch. So they touch at the top, and they also touch at the wrist. So the top one would be known as the proximal radial ulnar joint, and the bottom one would be known as the distal radial ulnar joint because it's further away from the attached end of the limb. Okay, so that's one of the trickier ones, sure, but once you get your head around it, I'm sure you'll be able to handle that no problem. The last couple is about the layering of the human body tissues. So is something superficial? Is it nearer the surface, which would be the skin of the human body? Or is it deep and further away from the surface? And getting an idea of the layering of the human body is a great thing, because there are many, many layers and structures to us, and knowing where one sits as opposed to another is a great bit of knowledge to have. So again, we could look at two structures in the torso here to get an indication. So if you had, we know that under the skin we have muscle, we have the abdominals, we have fat, some of us too much fat between the muscle and the skin, and we also have our intestines and inner organs underneath that. So if we used an example of something being superficial, then the skin is obviously superficial. It's one of the most superficial things in the body. You could argue hair on top of that, but skin is superficial. So if we were comparing skin to abdominals, then obviously the skin is superficial to the abdominals, and the abdominals are deep to the skin. What about fat? Where does fat sit compared to the abdominals and the layering of the human body. Is the fat superficial to the abdominals, or are the abdominals superficial to the fat? You find the fat underneath. And the answer to that is obviously the fat sits between the skin and the abdominal muscles. So to bring out those abdominal muscles, get that six-pack, you need to remove the fat that sits between those muscles and the skin. So therefore fat is superficial to the abdominals. So your belly fat is superficial to the abdominals. The abdominals are there, they're just underneath. So where does that leave the small intestines? Well, the small intestines are obviously deeper. So when we talk about abdominals versus small intestines, we'd like to think that our muscles are holding those in. So they need to be closer to the surface. So the abdominals are superficial to the intestines. And if they're not, you have a hernia. And you should probably go see someone about that. Okay, so hopefully those words make a bit of sense to you. You're getting a gist of how we might use them to orientate things around the human body. And just to cement that information, I've got a little worksheet here for you. If we click to it here, there are a few questions here. All you need to do is choose one word out of the two bolded options that are there and try to answer these questions as best you can. So again, I suggest you pause the video, go through these questions, and jump back in when you've had a crack and you think you know the answers to them, and we'll run through the answers. Okay, so hopefully you've had a bit of a look through those 10 questions there, and you're pretty confident that you've nailed the right answers. So some of them are easy, and some of them are a little bit trickier, but we'll go through them and see how you went. So the face is obviously on the front, which makes it on the anterior side of the head. The wrist, and look at what we're comparing it to here, we're comparing that to the hand. The wrist is closer to the shoulder than the hand is, so the wrist is proximal to the hand. We talk about the elbow versus the shoulder. Well, the shoulder is the most proximal point, isn't it? The shoulder is the attachment point, so the elbow must be further away than the shoulder. Now, a reminder that we always talk about the first word. That is the subject that we're interested in. So the elbow is, of course, distal to the shoulder because it's further away from the attached end of that limb. The skin is on top of muscles, making it superficial. So the skin is superficial to muscles. The knee is superior to the foot because it resides above. Now that's a situation, like I said, we could easily have used proximal to describe the knee's location to the foot as well, but obviously it's easier as well to talk about superior and inferior. Is it closer to the head or is it closer to the feet? That's a perfectly legitimate way of talking about where objects are, and you may prefer that way. The spine is anterior or posterior. The spine is, of course, more towards the back, so it would be posterior. The shoulder, again, is the attachment point of the limb, so it must be the most proximal, and it's certainly more proximal than the hand because it is the shoulder, and the hand is obviously further away or more distal. So the shoulder is proximal to the hand. The thumb, now this one might have been tricky. What do you have to keep in mind? What position is the person in when we're talking about them here? And that, of course, is the anatomical position, which means their palms would be facing forward, which means their thumbs would be lateral to the fingers because the thumbs will be on the outside if the person is in the anatomical position. The small intestines, compared to the abdominal muscles, well, we know they're underneath, so the small intestines should be deep to the abdominal muscles. And the heart, just to finish off, is in the middle of the lungs, which makes it closer to the midline, and it is, of course, medial to the lungs. So hopefully those went well. Hopefully you feel like you've got a decent understanding of those guys there. And as we go through and introduce more body parts, as we go through this anatomy and physiology subject, we'll use this terminology and you'll be able to check back on these and make sure you understand and cement that learning. Okay, so the final part of the session today is all about joint movement terms, and this is definitely the most usable information for a PT that you're going to be able to take out of this lesson here. You're going to learn about muscles and the actions that they are responsible for in two different ways throughout the two courses you're learning at the moment. In EP, you're going to focus more on this is the exercise and these are the muscles it targets, and that's fine, and some of you will learn that really well that way. You'll learn that this is a chest press and the muscles targeted in this chest press are the pectoralis major, the anterior deltoid, and the triceps, and that's great. And if you've got a great memory, you'll understand that, and that will help you to piece together what each exercise targets, and that's great. But there's another way of learning this as well, and that's how we're going to attack it in A&P. I want you to learn the key movement planes of the body, and I want you to learn the key movement terms of the body. Because once you understand flexion and extension and abduction and all these terms we're about to go through, and you attach muscles to those, then you'll never be stuck for what an exercise is working. You'll always be able to regress back to this information here and determine exactly what muscles are being targeted with a different exercise. Now that's really important when you see variations of exercise and you wonder to yourself, well, why did they do that? Why did they use that grip instead of this grip here? And how does that change the way that a muscle is targeted? Well, once we go through this information here and make the connections with muscles, then you'll be in a much better place to do that. And so you can see some of the movements on this front page here. Flexion and extension, which we know is primarily in the sagittal plane, forward and back. You can see those having all the major joints, flexion and extension, including the torso on the right hand side. But let's crack through these exercise sort of movements in order, make some connections. I'm going to start with abduction and adduction, and I'm often going to refer to abduction as abduction, just to make it very clear what I'm saying, because they do sound very, very similar. So abduction or abduction and adduction are performed in the frontal plane. So you can see that this is an arm being raised out to the side and then brought back to the side. So in this movement here, abduction is away from the midline. So you are lifting that arm up and you are taking it away. The hand is moving away from the body. And then in this one here, it's moving back. And one way to think about that, you're adding back to the body. Okay, so when it's coming back to the body, you're adding the arm back to the body, and that is adduction. And if this arm was to continue right across the body, right across the midline, it would still be adduction all the way. However, bearing in mind if it was right across the body and it started moving in the other direction, that would of course start the process of abduction. Even though it hasn't yet left the body, it is moving in abduction. Okay, so something can be in a position of abduction. Right here I would say this person's shoulder is abducted to about 100-110 degrees, with 90 being the parallel, so straight out the side, horizontal. So about 110 degrees of abduction occurring there. Okay. Now, it's moving in adduction over this side, but if they were to stop in this position, then I would say they're roughly 45 degrees of abduction. That's where the arm had stopped. Okay, and then we can take it across the body as well, and that would move further into adduction. Okay, so that's shoulder. Of course, we can do it at another of our ball and socket joints. The hip can also abduct and adduct, and you can see those two movements there. Again, it's the same thing. The leg has been taken away from the midline, out in the frontal plane, that's abduction, and then the leg has been brought back in and potentially right across the standing leg, and that would be considered adduction. Now the good thing about these movements here is when we get into the gym links, the gym movements are simply called hip abduction and hip adduction, and the machines that target them are called the hip abduction machine and the hip adduction machine, so that's pretty simple. Other things that can abduct and adduct in the body, there's only a few, and probably the other primary one is the hands. So the fingers can obviously splay, and that would be called abduction of the fingers, and then they can pull back together, and that would be called adduction of the fingers. Okay, so flexion and extension occurs at multiple joints through the body. That's not just a bending or lengthening of a limb. Okay, that's one way of looking at certain ones, like the elbow and knee, but actually can become a little confusing if you only learn it in that context. So flexion is actually a diminishing of the joint angle. So if we imagine this arm here that's down in its more extended position, we'd say that that angle is close to 180 degrees, or a horizontal line. Okay, and as we flex, the angle that is created at the elbow here diminishes. So it gets less and less, getting towards sort of 90 degrees of flexion when we get to this top point here. Okay, so any movement that that diminishes the joint angle, makes it lower, is flexion. And then of course when you increase the joint angle by taking it back towards that parallel marker there, then that's called extension. So this would be flexion, extension of the elbow. At the ball and socket joints, it's slightly different. Okay, so these are a little bit difficult to remember because it's not as simple as saying, well, it just bends and extends. Okay, so in this movement here, you can see that when the shoulder is brought forward and the arm is brought forward with a straight arm in front of the body here, this is known as flexion of the shoulder. Okay, and then when you take it back again, that movement is known as extension. And if you go beyond normal parameters, then you can call that hyperextension as well, which is typically not a good thing. So I wouldn't say that this position here, out the back is hyperextension. That's definitely just extension, like throwing an underarm ball. It would start with extension back and then shoulder flexion coming forward. But if you were to take it right up and really force it, that would be known as hyperextension there. Now, one thing to note, when we go through this portion of the studies, and we will be doing a practical on these movements in class the next time we meet, I want you to remember it's really important to identify which joint you're talking about. Because an arm can lift up in front of your body straight like this, and yes, that would be shoulder flexion. But what if the elbow was already bent? Does that take away from the movement that's happening at the shoulder? And the answer is no. Of course, if a person was performing an uppercut and they'd bent the elbow and they'd raised the shoulder up in front, it's still shoulder flexion. It's no different. The movement of the shoulder is no different whether the elbow is flexed or extended. The only difference is it would be shoulder flexion along with elbow flexion. So when we're really trying to identify what movements are happening, you have to envisage just the joint that you're talking about, okay, and almost forget about the other movements at that point so you can identify what the movement is at the joint that you're interested in. So flexion out in front, extension, taking it back. The same thing occurs at the other ball and socket joint. You can see when the leg is out in front, that is hip flexion, okay, originating up here at the hip. And taking that leg out in front, again, it doesn't matter if the knee's bent or not, we're only talking about the hip movement at this point. If you take it back behind you, that's known as hip extension. And if you, of course, force it to go further than it normally would, that would be known as hyperextension, which is typically not a good thing again, and is where we may run into problems with muscle tears, etc. Now, we'll start adding some muscles into the mix soon, but you can already get an idea of what muscles are working here, right? Hip flexion is the domain of the hip flexors. That's what they're for, and that's why they're named. And hip extensors are obviously responsible for hip extension. But we're going to learn that deeper than that. The major hip extensor is the glute maximus, the butt cheek here, effectively. So we learn that it's responsible for that movement. So anytime the hip extends, then the glutes are obviously going to be involved. Now, something to consider here, there are different ways in which you can flex and extend at the hip. In this one here, we're standing and we're simply lifting a leg off the ground and we're flexing and extending it. But what if you were to sink into a movement like a squat? Now that would also be hip flexion. The reason being, going back to the flexion definition I gave before, it's a diminishing of the joint angle. So when you're standing up straight, then you have a 180-degree angle, a pure vertical line. And then when you squat or lift your leg out in front, notice how the angle to your torso diminishes. So as that leg comes up, we get a sharper angle occurring here. Now when you squat, you obviously sink your butt back, but you still create an angle between your torso and your thighs, and that angle diminishes as you go lower, which means you get deeper into hip flexion. Now if you sink into hip flexion, what are you going to have to do to come back again? You're going to have to extend the hips, okay? And by extending the hips, that means you're going to use your hip extensors, your glutes, and that is going to be responsible for that part of the movement. The driving force to get you back up is going to be glute dominated at the hips. Now when you squat though, we know there are other muscles and other joints at play. Primarily the knees are going to be bending, so we need to look at that movement too, which we'll do shortly. Okay, we can flex the spine as well. So we can flex the truncal spine by leaning forward. Notice that the hips haven't moved in this context here, but the torso has moved over the top, and that would be known as trunk flexion, if you like. When we take the trunk back, it's known as trunk extension. And of course, this guy is almost going towards hyperextension there as well if he went too far. Here's where the knee flexion and extension occurs. So again, in a pure movement, if you were standing, you could simply bend your knee like in a hamstring curl, and that would achieve flexion because we're diminishing the joint angle. You can see again a straight line angle to start, and then we're getting to around a 90-degree angle here. Diminish the joint angle, that's flexion. Extend it back out again, and that's extension. Now that movement I just mentioned is similar to a hamstring curl, so you understand that the hamstrings are responsible for knee flexion. The quads, on the other hand, are there for straightening your legs, so they would be there for knee extension. Now put it in the same context of the squat that we talked about before. When you bend your knees in a squat, that's obviously flexion. Okay. And when you extend your knees when you come up, at the same time as you extend your hips, you're obviously extending the knees using the quads, and that's the working phase of the movement. So that's why a squat typically works the quads, which will help straighten your knee, and the glutes, which will help straighten your hips. Okay, and that's why they're the key target muscles there. Alright, only ball and socket joints can rotate. Okay, so what we need to imagine here, I know there's a forearm and a hand out here that's giving you an indication that something's moving across the body or away from the body here, but the actual movement is occurring along the humerus, which is in the shoulder here, and that is a rotation is occurring here. So this stuff is simply moving with the bone that is rotating. Here's where the movement originates, and this is just an appendicular part of the arm which is following along that movement. Okay, so when you rotate your humerus internally, so you turn it in towards your pec muscles and torso, then that's known as internal rotation. And when you rotate it externally, it's known as external rotation. And it doesn't matter if you've got your arms at your side like this, or whether they're up at a 90-degree angle here, like this. So your arm was up here in sort of a shoulder press position. If you were to rotate them forward and back there, forward would be internal rotation and back again would be external rotation. The same movement, just done with some shoulder adduction in play as well. So that would be a mixed movement we're talking about there. Okay, and here is hip internal rotation and hip external rotation. Again, it looks a little off-putting because you're worried about the tibia and the foot here and where that's going, and for me you're looking at that going, well, that's going away, so how can that be internal rotation? Because what we're talking about here is rotation of the femur, and that femur is rotating in towards the other leg. It's rotating in this direction here. Okay, so we're coming around in this direction here, and that's forcing that leg to go out, and that's why it's called internal rotation of the hip. Whereas over here, this guy here is rotating externally, so we're rotating the femur this way, and that's taking the lower appendages of the lower limb on an inward motion there. So a little bit confusing, but remember, what are we actually talking about? We're not talking about movement of the knee or the shin, we're talking about movement of that bone, the femur, and how it's rotating around its axis there. We've also got trunk rotation, so you can turn your trunk and twist it in that transverse plane, and that's pure trunk rotation. We don't need to worry about internal or external here. We rotate away from the midline or towards the midline. It's all trunk rotation. And you can also laterally flex the trunk. Now, some of us can't do it to that degree, but any side bending that occurs would be called lateral flexion of the trunk. Movements of the neck almost operates as a ball and socket joint. It's not a ball and socket joint. The movements that are here are the domain of the top two cervical vertebrae. So we have two joints involved here. One is a hinge joint that makes you nod forward and back. So you can see diminishing the joint between the neck and the torso here is flexion, and then widening out that joint there is called extension. We can rotate using the second vertebrae in the neck here, called the axis joint, which is where you would we call it your no joint, if you like. So you got your yes joint, the first, the atlas, the first vertebrae in your neck, and then the second one down is your rotation one, and that's a pivot joint called the axis, so rotation. You can also laterally flex your neck to the side, so ear to shoulder on one side, ear to shoulder on the other. These ones are movements of the scapula, and because the scapula is attached to the arm and helps form the shoulder joint, then obviously when you move the scapula up, the arms and the shoulders go with it, right? So on this one here we have elevation of the scapula, where the shoulders are being shrugged up, okay? And many of you will know that the muscle responsible for that is the superior trapezius here. Okay, so you can see it bunching as it lifts up the scapula there. That's called elevation. And depression is where you force your shoulders back down. There's not many gym movements that would actually do that. That's usually a gravitational relaxation, so when you relax and the muscles go back down. But if you were to force your shoulders down, then you would move into what we call depression there. And then the other key movements I guess we have in the gym is pulling the shoulder blades back together, and that's good for posture, obviously. It's still the domain of the trapezius here, the middle trapezius fibers. If your arms were spread out wider, you might also use your rhomboids to pull your scapula back together, and that's known as scapular retraction. Going the other way is actually known as protraction. Again, there's not many situations in the gym where we'd ask someone to protract their shoulders by letting them roll all the way forwards. Most people have rounded shoulders and therefore benefit from more scapular retraction. So again, we can start to make links to gym movements here. Anything to do with a row would obviously involve some scapular retraction there. So things to keep in mind. We will make those muscle connections soon. Okay, so we've already talked about abduction and adduction, and we talked about how it's movement away from the midline or towards the midline, but we've only looked at it in a vertical sense at the moment. So we've looked at it from the perspective of standing and taking your arms away and up for abduction and then back down to the body for adduction. The pictures that you're looking now at are horizontal adduction and abduction, and it's a similar concept. We're taking the arm either away from the midline in this bottom picture here or towards the midline in this other one here, but it's in a horizontal sense. So this person has their arm flexed out in front at about 90 degrees of flexion, and then in the picture that you're seeing at the bottom here, they're then rotating that arm or abducting that arm away from the midline, but it's in a horizontal sense, and that's known as horizontal abduction. And when they pull it back across their body in that horizontal sort of plane there, then that's known as horizontal adduction. So the key exercise that this probably relates to is a chest fly. Whether you're in a chest fly machine or whether you're lying on a bench and you're bringing your arms together in a horizontal fashion and away again, and that's of course targeting the pectoralis major, which is a horizontal adductor. Okay, so abduction gives it that nice stretch, and then adduction would be coming back to the midline, working those pecs. Now you could also do a reverse fly. Okay, so you could do one where the weight started at the middle and you pull your arm back, and that of course would be working the back muscles, the antagonist muscles on the back of the rhomboids and some of that middle trap as well, posterior delt too, as you pull back, and they would be your horizontal abductors. So again, we'll make links to those muscles in the next segment that we study. Okay, simply turning your forearm over to present a palm up or palm down, that's known as supination or pronation. And really the reference that we're going to take out of this is for grip in the gym. So you would either grip in a supinated grip, which would be palms up, so an underhand grip in many cases, like on a chin up or a lat pull down if you were going to create an underhand grip, and that would bring in more bicep orientated movement, or you might go to a prone grip. Okay, a prone grip would be with the backs of your hands facing towards you. Okay, so like the way you would put your hand out to pat a dog or play the piano or something like that, that's pronation. Okay, so some movements that we do actually move from pronation into supination. So if you think of a bicep curl which starts in a pronated position and then turns as it comes up, and you could activate more bicep effectively by encouraging a supination movement there. Okay, well, what happens if you're doing a hammer curl or you're holding on to something with your hands in between pronation and supination? It's typically referred to as a semi-supinated grip if you're taking a sort of hammer approach to an exercise. Okay, specific movement for the ankle. Probably heard of this term before, plantar flexion and dorsiflexion. Most commonly described as being toes pointing down or toes pointing up. That's not the full story there. If your foot was out in space, so you had it off the floor and you pointed your toes, sure, that is plantar flexion. You're effectively extending the angle, okay, from the shin right through the toes, about 180 degrees there, and then you're shortening or diminishing the angle there, which is more of a flexion movement, and that is dorsiflexion. Okay. Other ways people have remembered this in the past is the dorsal fin of a dolphin, which sticks up in the air, so dorsiflexion. But the key way is the diminishment of the joint angle here again. Okay, and I'll use the example of a stretch. If you imagine a calf stretch where you've got your hands on the wall and you've got one leg out behind you, and you're leaning forward and taking your body weight forward and stretching that back calf. Well, what position is your ankle in at the back when you're in that calf stretch? So the answer to that is dorsiflexion. Okay, even though you haven't lifted your toes, what you have done is you've rotated your shin bone forward and you've diminished the angle between the shin and the foot, and that's why that would be a dorsiflexion action. If you held that position and then took your body weight back and stood up, you would actually be on your heel with your toes raised in the air if you held that position rigid while you stood back up again. So plantar flexion, how do we relate to that in the gym? That's obviously anything like a calf raise or a jump squat or something like that is going to involve plantar flexion. And when you think about those movements, what's targeted, it's obviously the calf at the back of the lower limb there. And a dorsiflexion movement, not really targeted in the gym. I mean, you don't sit there with a weight on your toes generally and do, I don't know, toe crunches or toe lifts. Typically, we would work that muscle out just by walking or running, where you need to get that additional foot clearance. And as long as you do a lot of on-your-feet activities, you should be able to strengthen that tibialis anterior, which is responsible for that movement there. Okay, so let's have a look at some of these movements here and see if we can work out what's going on. Again, probably a good idea if you pause the video at this point and then jump back in when you'd like to hear the answers, and whether you just do them one at a time and keep pausing and starting, up to you. But let's see if you can work out what the primary movements are. Just a reminder, make sure you read carefully what joints are being focused on in each movement here. Okay, so the first one, when you're doing a squat, what movements are there at the hip and the knee during the up phase of the movement? So you've already got down to the base of the squat, which we know would involve some knee flexion and some hip flexion going on there. Okay, so what happens in the up phase? Well, the hips are going to return to their starting 180-degree position with the torso, and that is going to be hip extension. And the knees are also going to return so that the legs are straight, and that is knee extension. So hip and knee extension. What movements happen at the shoulder when you scratch between your shoulder blades? Now, I should have clarified this one here. It depends how you scratch between your shoulder blades. Are you an underhand scratcher or an over-the-top scratcher? And the one I was hoping that would come into your mind then, if you had to scratch between your shoulder blades there, you might go over the top. So you would lift your arm up and you would come over beside your head, beside your ear, and you'd scratch between your shoulder blades there. And that would mean taking your arm directly up in front. Okay, so the movement is at the shoulder, and what is that movement when the shoulder goes directly up in front of you? It's known as shoulder flexion. Okay, yes, there would be elbow flexion there as well as you bend your arm to try and scratch, but the shoulder is the thing that we're interested in, and that is definitely shoulder flexion. What movement happens at the ankle when you stand on tiptoes? That one is definitely toes pointing down, and that is movement of the calf muscle, obviously, and that is plantar flexion. What position is your forearm in when you knock on a door? And here I'm talking about a good manly, firm knock, okay, with the back of your hand facing your face, and you're knocking with your knuckles, and that would of course be pronation. Okay, you'd be in a pronated position there. What movements happen at the hip during a star jump? Well, that's a pure frontal plane movement at both the hip and the shoulders, obviously, but if we just use the hip as the example, the first movement is away from the midline, which is abduction. And then the second movement is coming back to the midline, which is adduction. When you stretch your calf, what movement happens at the ankle? So we've already talked about this one. That is where the shin rotates forward over the foot, diminishing the angle at the ankle, so it must be dorsiflexion. When you're playing the piano, what movement happens at your forearm? Or what do you hold your forearms in? Unless you're a bit spastic and playing with the backs of your fingers, you would want to be in a pronated position there. That's a good way of thinking about it. Pronation, play the piano. Supination, hold a bowl of soup, palms up. When you perform an uppercut in boxing, what movement occurs at the shoulder? So the uppercut should come from nice and close into your body. Obviously the arm is coming up in front of you. What movement occurs at the shoulder? That is going to be the shoulder raising directly out in front, and that is shoulder flexion. Okay guys, so hopefully that helped clarify some of those movements there. We've come to the end of the presentation, but that's not the end of our work that we do on this. This is literally just to inform you a little bit about these terms, let you hear them, let you see some of the pictures associated with them, and the next step is to embed this learning. So when we next meet, we'll be doing a practical. We'll use some of this information you've then got. I'll get you moving each other into certain positions, and we'll start to make those connections between muscles and those movements that we just saw. And some of you may already be able to do that, which is great. So thanks for listening in. Remember, you can check out the full Prezi on the Moodle website and go through it at your own pace, but no need to do that if you've taken on board the fact that you've heard these words for the first time and you're a lot more informed than you were before. That's fine going into the prac. So catch you soon.